There are three major types of uterine fibroids. Intramural fibroids grow within the muscular uterine wall. Submucosal fibroids bulge into the uterine cavity. Subserosal fibroids project to the outside of the uterus. If you don't have symptoms, intramural fibroids don't require treatment, just monitoring. However, if you have symptoms, there are treatments available, ranging from birth control to lighten your periods to the surgical removal of the fibroids. The exact cause of intramural fibroids is unknown. Many doctors believe that fibroids develop from an abnormal muscle cell in the middle layer of the uterine wall. When that cell is influenced by estrogen, the primary female hormone, it rapidly multiplies and forms a tumor. As they grow, submucosal fibroids can block and distort fallopian tubes, making it impossible for the sperm to travel to the uterus for implantation. This disruption is often what will lead to fertility issues for women with these fibroids. In addition, submucosal fibroids can cause complications due. However, large intramural, and to some extent subserosal fibroids, that enlarge or distort the uterine cavity can cause bleeding problems. Surgery is quite often required in these situations as medical interventions may be less effective. Subserosal fibroids project to the outside of the uterus. Some submucosal or subserosal fibroids may be pedunculated, hanging from a stalk inside or outside the uterus. Uterine fibroids are non-cancerous growths of the uterus that often appear during childbearing years. Subserosal fibroids aren't dangerous, but they can cause severe discomfort and impact nearby organs, such as the bladder and bowels. This type of fibroid can lead to abdominal cramping and pain in the lower back and legs. Curcumin. Curcumin is an antioxidant found in turmeric. It also has anti-inflammatory properties. Resveratrol. This chemical is found in blueberries, raspberries, grapes, and mulberries. Green tea. Green tea contains antioxidants called flavonols. Avoid added salt. Limit high sodium processed and packaged foods. Check your blood pressure daily with a home monitor. Exercise regularly. Lose weight, especially around the waist. Avoid or limit alcohol. Increase potassium by eating a majority of plants at each meal. Certain procedures can destroy uterine fibroids without actually removing them through surgery. They include uterine artery embolization. Small particles embolic agents are injected into the arteries supplying the uterus, cutting off blood flow to fibroids, causing them to shrink and die. Don't eat a diet full of processed foods, red meats, and high-fat dairy. Studies show that eating these foods can make your fibroids worse. The same goes for alcohol and caffeine. Don't skip your workouts. Apple cider vinegar. It is a great way to treat cysts and fibroids. Take 2 tablespoons of apple cider vinegar and mix it in a glass of water. You can also add 1 tablespoon of baking soda to it. Drink this solution regularly for best results.